This segment of DelmarvaLife is sponsored by TidalHealth.
February is a month where we get to celebrate love with things like chocolate, flowers, sweethearts, and so much more. It's a time where many of us are thinking with our hearts, but as we all know, it's also important to think about our hearts no matter what time of year it is.
Yeah, one of the most important things to think about as we try to remain healthy throughout 2024 is keeping our hearts healthy. Now, given that February is Heart Month, we thought it would be a good idea to get some tips on how to spot symptoms of someone having heart complications, and that is why we're here to talk with Dr. Marninder Singh. He is a cardiologist with TidalHealth. Thanks for joining us this afternoon.
Thank you for having me.
Of course, we were just saying that this is the month that we raise awareness to heart issues. Why do you think it's so important that we talk about, I guess, the symptoms of a heart attack?
Yeah. It's actually, what I would say is treatments for heart attack have improved tremendously over the last few decades. But one of the things which is really key is timely recognition of symptoms of a heart attack. If we have a patient who knows what to expect and they're aware and they're educated and they present to us soon enough whenever they have a heart attack, there's a lot we can do for them. The outcomes in the long term are a lot better compared to somebody who waits several hours before coming to the hospital. So I think that's one of the reasons awareness of these symptoms is very important. As soon as somebody notices these symptoms, come to the hospital right away. The treatments we have are very, very effective, but really depends on how soon they come to seek the treatment.
Sure.
And you mentioned how folks, if they can recognize the symptoms, what are some of those symptoms that people should be looking out for?
So most commonly patients present to us with chest discomfort, and it doesn't have to be pain. Some patients just describe it as weight in the middle of the chest. Some people describe it as a band-like sensation, tightness, heaviness, pressure. And a lot of times it's accompanied by shortness of breath. Some people become sweaty, and some people feel like they're going to throw up. So these are the most common symptoms we come across, but there are sometimes we have patients, especially those who have diabetes, they may not have classical symptoms.
You know, we often hear the phrase, time is muscle in relation to heart attacks. Could you explain what this means and why that early intervention is so vital?
Yes. So it kind of comes back to the same thing again. You know, if somebody presents to us sooner, their long-term outcomes are a lot better. And whenever heart attack occurs, it's because of an artery which is occluded. So if I have a patient who comes to us right away and we open up the artery to do the intervention, it's very likely they're going to be able to live a normal life back again, even though they had a heart attack. Now, compared to that with the patient who waited several hours or even 24 hours before they present to the hospital, we can still open up the artery, but a substantial portion of the heart muscle has probably already died by that time. So they're going to suffer from various negative issues like congestive heart failure, some shortness of breath symptoms in the long run.
Yeah. And of course, everyone's different as far as who is at risk, different demographics and factors like that.
Yes. So when it comes to risk factors, we like to think of it as modifiable and non-modifiable. So modifiable, a lot of this comes down to some of the things are lifestyle choices like smoking, sedentary lifestyle, being overweight, obesity, not exercising enough. And things like hypertension, diabetes, as well as cholesterol problems, these are all considered as modifiable risk factors. On the other hand, non-modifiable risk factors like family history, genetics, this is something which is definitely beyond the individual's control.
Right.
Yeah.
So if we suspect somebody is having a heart attack, ourselves included, what should we do?
So I say call 911, get them an aspirin as soon as possible.
Okay.
All right. Good information. Know your symptoms and know your risk factors.
Yes.
Thank you so much for joining us
problem.
this afternoon.
Thanks for having me.
Appreciate you.
Yeah, thank you.